The microphone and updating us on the situation with the latest modeling projections. Let's try and dip in live.
Virtually, and Dr. Howard New, who's the Deputy Chief Public Health Officer, and they will be speaking to us about COVID-19. Minister?
Merci beaucoup et bonjour tout le monde. Good morning, everyone. Merci de vous joindre à nous aujourd'hui. Thank you for being here. Today, I will proceed with an update on the COVID-19 situation and more specifically with the Omicron variant of concern. Comme vous le savez, notre gouvernement a rapidement mis en place des mesures pour ralentir la propagation de ce variant au pays. Nous voyons toutefois que dans de nombreux pays à travers le monde, la situation s'aggrave et que les cas se multiplient. Countries around the world are seeing or projecting an important rise in a number of cases. Dr. Tam and Dr. New will speak to this as part of their modeling update in a few minutes. As a government, our objective is simple. We want to protect the health and safety of Canadians and protect the gains that we have made in the fight against COVID-19 over the last 20 months. This is why we have put into place new measures to mitigate, import, and slow the spread of the new variant in Canada. It's important to keep in mind that these measures might change as we adapt to this evolving situation. Comme nous l'avons annoncé le 30 novembre dernier, nous sommes en train de graduellement augmenter notre capacité de tester les voyageurs à leur arrivée aux aéroports canadiens. As announced on November 30th, we are gradually ramping up our testing capacity at international airports. Today, I would like to provide you with a brief quantitative update of that increasing testing capacity. On November 30th, our capacity for all air travelers from all countries was of 11,000 tests per day. As of yesterday, December 9th, that capacity has increased to 17,000 tests per day. The end state to test all non-US air travelers is a capacity of 23,000 nationally. We are therefore halfway. At the Vancouver International Airport, we've gone from 2,080 tests per day on November 30th to a capacity of 3,130 tests per day on December 9th. At the Calgary International Airport, we've gone from 910 tests per day on November 30th to 1,460 tests per day on December the 9th. At the Toronto Pearson International Airport, we've gone from 5,232 tests per day on November 30th to 8,317 tests capacity per day on December the 9th. At the Montreal Trudeau International Airport, we've gone from 2,128 tests per day on November 30th to 3,033 tests per day on December the 9th. Je vais maintenant répéter tout cela en français. En date du 30 novembre, notre capacité de test aux aéroports canadiens, capacité totale pour tous les voyageurs aériens de tous les pays, était de 11 000 par jour.
1,100 per day. Now we are at 17,000 tests per day, which is a little over a 50% increase. 23,000 is the capacity required to test all air travelers from other countries other than the United States, which means we are halfway. At the Vancouver International Airport, we went from 2,080 tests per day on November 30th to 3,130 tests on December 9th. At Calgary International Airport, we went from 910 tests per day on November 30th to 1,460 tests per day on December 9th. At Toronto Pearson International Airport, we went from 5,232 tests per day on November 30th to 8,317 tests per day on December 9th. At Montreal Trudeau International Airport, we went from 2,128 tests per day on November 30th to 3,033 tests per day on December 9th. As you can see, our testing capacity is increasing steadily and significantly, but it remains limited.
You can see our testing capacity is increasing steadily and significantly, but it still remains incomplete. In order to further increase our capacity quickly, we've awarded contracts to private companies, providing us with additional testing and processing services. These companies include Switch Health, Life Labs, and Dynacare. Ces compagnies vont nous aider à augmenter notre capacité.
These companies will help us to increase our capacity to test travelers upon arrival until we are able to test all targeted travelers as we announced on November 30th.
Once again, to anyone who is planning to travel, I will say this: you need to plan ahead. Be prepared for airport delays, have a quarantine plan, and be sure to use the ArriveCAN application or website to submit your information before you arrive at the Canadian border. You should also be prepared for officials to follow up with you to make sure your COVID testing is complete. The goal of these measures is, and always has been, to protect the health and safety of all Canadians. Par ailleurs, mercredi, j'ai tenu une autre rencontre.
On Wednesday, I held another meeting with my provincial and territorial counterparts to keep them apprised of the evolving situation.
Today, I met with my provincial and territorial counterparts and provided them with another update on the ongoing situation. Over the course of the pandemic, our government has made significant investments in order to build testing capacity with the provincial and territorial healthcare systems. Through the Safe Restart Agreement, we have transferred over $3 billion to provinces and territories for testing and contact tracing. The federal government has also purchased 95 million rapid tests and shipped 86 million rapid tests to provinces and territories. Depuis le début de la pandémie,
Since the beginning of the pandemic, our government has made significant investments to enable provinces and territories to develop their testing and contact tracing capacities.
à travers l'entente pour une relance sécuritaire,
Through the Safe Restart Agreement, we directly transferred over $3 billion to the provinces and territories. The Canadian government also purchased 95 million rapid tests, 86 million of which were directly shipped to provinces and territories. As you know, the provinces and territories' requests for these rapid tests also quickly increased. For a number of months, those tests were largely underutilized, but for the month of December, the province are hoping to receive approximately 35 million of them, which is about 5 times the tests that were unused over the past year. This is excellent news. And as we have always done since the beginning of the pandemic, we will respond to provincial and territorial requests, and we will assure that these tests will be shipped in time for the holidays.
is growing. For the last year, these tests were largely underutilized, but for the month of December only, provinces and territories have requested around 35 million tests. This is very good news, and we will ensure that provinces and territories get these tests in time for the holidays. Finally, I would like to take a moment to come back to the National Advisory Committee on Immunization's recommendations from last week. As clearly stated by NACI, booster shots are safe and an effective way of enhancing our collective level of protection against the virus. I encourage all Canadians to get a booster shot as soon as it is possible. In our meeting on Wednesday, I reassured my provincial and territorial colleagues that the federal supply of vaccines is ready and available for them to use. Finalement, j'aimerais revenir rapidement sur les recommandations.
Finally, I would like to quickly come back to the National Advisory Committee on Immunization's recommendations. As the committee clearly indicated, boosters are a safe and effective way to increase our collective protection against the virus. All Canadians over 18 years of age can now have a booster shot as soon as possible, as the committee recommended.
In closing, I want to take a brief moment to take stock of the formidable progress we've made over the course of the last 20 months. It's been tough for all of us, et nous ne voulons pas revenir.
And we do not want to move backwards.
The Omicron variant of concern is a cruel reminder that the global epidemiological situation can change quickly. We all need to be prepared for that as well. At any given time, we may need to change gears, adjust our plans, or change our behavior to meet the needs of the moment. That goes both for individual Canadians and for their governments. Canadians who are thinking of traveling abroad need to be warned that the situation abroad is both risky and unstable. They should also know that returning to Canada will likely involve delays and hassle. Je vais maintenant me tourner vers
Now, I will open the floor for all questions and comments before we move on to Dr. New and Dr. Tam's presentation.
Very much, Minister Duclos. As you mentioned, Minister Duclos will be taking questions for about 30 minutes. Then Drs. Tam and New will present the modeling, and then they will take questions specifically on the modeling. Those who in the room who would like to ask a question will go to the microphones, and then after that we will go to the operator and people joining us by phone. First question, and when I call on you, can you tell me your name and your media organization? Mic to my right.
Bonjour, Louis Blouin.
Good day, Louis Blouin from Radio-Canada. Can you talk to us about numbers in the airports? What is your goal? When would you like to reach that 23,000 tests per day? Mr. Duclos. So we were at 11,000 tests in all Canadian airports for all international travelers, including those coming from the United States. Now we are at 17,000, so it's about a 50% increase, and we will need to reach the 23,000 per day as quickly as possible, which is why I gave that information on those three companies, which will be helping us to reach that $23,000 threshold as quickly as possible. Those figures might not be completely indicative of all of the progress that has been made over the past days, because if I may, as you know, I love numbers. 11,000 was the sum of all tests in all Canadian airports, but of that 11,000, about 3,000 were specific tests for air travelers from other countries than the United States. And it is for those travelers that we are investing efforts. We went from about 3,000, and we have already added about 6,000 to that basis of 3,000, which is a very significant increase, and we will keep working to meet the final result. Follow-up question. So do you know, as a matter of days or weeks or months, when that will happen? Secondly, there has been a change in dynamics with this Omicron variant. People are planning Christmas parties. Some are deciding whether or not they should cancel their trip down south. What is your recommendation? Should we avoid traveling or gathering? Can you send a clear message on that point? What do you advise? Answer. In a few moments, you will hear from Drs. Tam and New on the updated modeling and the forecast as well. We're observing that current cases, including in Quebec, are mostly with the Delta variant. Omicron is still very rare in Canada. And of course, that is thanks to our measures at the border. Of course, our measures are not perfect. We're hoping that they will work. And testing is sometimes inaccurate, as we know. And since tests are imperfect, travelers can still contribute to the spread of this virus in the country. But there were approximately 80 cases of Omicron in Canada at the last data. And this can help explain the significant increase in tests that we have been seeing in Canada. In Quebec, currently, we have the highest rate of new cases in the country. The Quebec government is doing its work properly. We're aiming to ensure that hospitalization rates are under control, but of course, we must remain vigilant. because there is generally a delay between the transmission of the virus and then later we see the increase in rates and hospitalization rates. Outside of Canada, the situation is evolving very rapidly. That is why my message is mainly regarding the international situation. My message is to people who are planning on traveling in the coming weeks. They must know that around the world, things can change rapidly. If you're following the numbers in Europe, it is getting very complicated in a number of countries. Certain countries have even asked school children to stay at home because the situation is deteriorating too quickly. In some countries, people had started to go back to work at their office, but they have been asked to stay home again. Things can evolve rapidly, and what I also try to express to people is that when people are trying to come back to Canada, that is also a time when things can change very quickly, and they must expect that things are going to get more complicated when it comes to traveling abroad and also coming back, and we are putting certain quarantine measures in place.
I'm saying good morning, Minister Duclos, Christian-Ashkate, CTV National News. Minister Marcy Ian is self-isolating at home after coming into contact at a gala in Toronto with people who have since tested positive. Should MPs and cabinet ministers be attending these large events given the rising case numbers? And have you had any contact with her on Parliament Hill this week, either in the House or at caucus?
Well, the answer here is that every Canadian, and certainly all parliamentarians, need to abide by the public health measures. Obviously, there are people who would naturally be more exposed to more people, and that's certainly the case of parliamentarians and public officials, including journalists. But whatever our role is in society, we need to be following public health advice. And when there is a risk or a likelihood that we have been in touch with someone infected, we absolutely need to follow the right public health guidance.
You haven't been in contact with Marcy Ian at all?
Well, I will have to check the details of that story, and I can come back to you.
Costs around €1 for a rapid test. In Ontario, it's $40 at Shoppers. Are you disappointed that provincial governments have not made the rapid tests you've given them more affordable and available for Canadians?
Well, we know it's been challenging for provinces and territories over the last year, and there's certainly no intention for me and for us here at the federal level to blame anyone. Experts have, however, said that we could have used rapid tests more often. This being said, experts also tell us that these rapid tests need to be used in a particular context, in a particular manner, in order to understand what they really can and cannot do. And two things that rapid tests can do quickly, and therefore things that rapid tests cannot do. The two things that rapid tests are quite good at is to provide what we call surveillance activity. So if in an environment like a school or hospital, a community center, a factory, there is no apparent sign of COVID-19, but we still want to be double certain, because it's a large community, then rapid tests are useful because they screen a lot of people rapidly and they get very ample results of whether there might be community transmission or community occurrence within that particular context. Now, the second thing that the rapid test can do is if you feel symptoms, and you want to have a rapid check of whether these symptoms are symptoms of COVID-19, and you take that rapid test immediately, and in 15 minutes you get the result. Now, if that result is negative or positive, doesn't matter. If you really feel symptoms that you may be contaminated with COVID-19, you need to take what is called a molecular or PCR test to validate that. But it gives you a quick idea of whether you should take immediate actions to isolate from others. So that's a useful tool, but not a complete tool, because you still want to be double certain by having a very precise molecular test. So these are the two main purposes for which the rapid test can be used.
Ashley Burke, CBC News.
Good morning, Minister Duclos. Same sort of question on the rapid tests. We're just hoping to find out, will the federal government continue to give rapid tests to provinces who are not distributing them widely and also freely to citizens?
Well, we've been providing these tests free, and we are continuing to do so. We are also multiplying by 5 just in December the average delivery of rapid tests over the last month. So this is, and that's great. Now we've been able to answer a relatively recent request from all provinces and territories to speed up the delivery of rapid tests. Now, so fortunately, we are able to do that, and in fact, match exactly the demand of PETs and provinces and territories for December, and we'll continue to do what we can to match further demands in the new year. This being said, how rapid tests are used in Canada in specific provinces and territories, that depends on the conditions and I would say priorities of provinces and territories. Like in Quebec just this morning, listening to the radio, in my home city of Quebec, I was hearing that they were, and that's great news, they were distributing the rapid tests in daycare centers. In Ontario, they've been distributing them in schools and universities, I understand. In Saskatchewan, they've been making them available directly, I believe, through pharmacies to the general population. So there are different models that have evolved in Canada over the last few weeks. And what I hear from my colleagues, what I heard from them on Wednesday, is that they are looking at each other and trying to see what works best. No, they don't need to work in perfect synchronicity, but I think they're looking at each other and trying to do as well as the others are doing, taking again into account that they have different conditions, different partnerships, and different priorities.
But as you stated in your opening remarks, there have been a lot of unused tests in provinces and territories as well. What is your message to those regions who are not distributing them more widely?
My understanding is that, yes, there has been a significant amount of unused rapid tests for a relatively long period of time, but at this particular date, at this particular period in the history of COVID-19, so at this time now, the stocks in provinces and territories are relatively low, and that's why the delivery of these 35 million rapid tests is going to help.
Okay, Mike to my left.
Good morning, Tessie Sanchi with Hill Times Research. Minister Duclos, I'd like to ask you about a separate matter that affects your office, which is drug pricing regulations that are supposed to be in effect on January 1. Your government has already delayed them 3 times. Can you say today on December 10 that those drug pricing regulations will be in effect on January 1, 2022?
Well, what I can say now is that we are obviously mindful of this important issue. I've been obviously in touch with some of the important stakeholders, including provinces and territories with which we need to work, and I will hopefully have something soon to say on the matter.
So you're not committing to them being in place on January 1, 2022. What would you say to stakeholders? It's been a bit of a hamster wheel, especially the last 2 delays. Folks have been getting notice 2 or 3 days, before the rules are supposed to be in place. What would you say to stakeholders who are just frustrated, whether they're for the rules or against the rules? They're not sure up until a few days whether or not there will be different rules in place.
Well, we understand, and I certainly understand that is a very important part of our overall efforts to reduce the costs and increase the access to medicines across Canada, including obviously the more costly medicines that have tended to emerge over the last years, almost all of them patented. So it's obviously an important piece of the agenda around making medicines less costly, more accessible, and also addressing the serious long-term challenges that we face in sustaining our healthcare expenditures over the next years. But I'll have more to say, hopefully as quickly as is feasible.
Okay, Mike Lecouture, Global News.
Still introduce myself if that's okay, Elizabeth. Mike Lecouture with Global News, Minister. Good to see you. I wanted to ask you, in light of what we're seeing with Omicron, not only around the world, but here in Canada, what is your advice to Canadians who are sitting around saying, I was promised that I can travel if I get double vaccinated, and I was promised that I can gather if I get double vaccinated? What are you going to tell Canadians? What is your message to them today about holiday travel and holiday gatherings?
Maybe I should turn to Dr. Tam, or Dr. New, who always say these things with greater eloquence and sometimes greater...
I'm sure they'll get the question later.
Okay, well,
since you're here, I thought I'd ask you.
Very good. No, because I wouldn't want you to feel that I'm forgetting about Dr. Tam and Dr. New, but that you are telling me that you won't forget about them. Now, what we can tell Canadians is something that they've known since the beginning of COVID-19. COVID-19 is a virus and then a disease over which we have learned many things over the last 20 months, and that's going to be the same with a new variant. And the new variant tells us that we need to be even more vigilant when, in particular, we think about traveling outside of Canada. As we said earlier, Omicron is not yet prevalent in Canada, has limited community transmission. That is going to change. And you'll look at the modeling of Dr. Tam and Dr. New in a moment. You'll see how it could change relatively quickly. But it's not, the community transmission of Omicron now is limited, and therefore it's not, domestically speaking, what people should think about when they plan their holiday opportunities with friends and families. However, if they think about traveling outside of Canada, Omicron should be a big red part of their radar screen. It should be flashing, because things are happening very quickly outside of Canada. And so if they think of traveling, that should be a serious alarm bell, a serious concern for them, because it's not only about coming back to Canada, and when they come back to Canada, they should expect delays and hassle. That's going to be it, because we're going to do what we need to do to protect the health and safety of Canadians at airports. But they should also be mindful that it's going to be uncertain and risky to travel in a number of other countries over the next weeks, given the serious increase in the incidence of Omicron that we are seeing abroad.
I also want to follow up on the rapid tests. In one case, you had said that they've gone largely unused. You also said that you don't want to blame the provinces and territories for not using them, yet the federal government has delivered nearly $100 million to the provinces and territories. They're going largely unused. How can you not blame the provinces and territories for not using something that you have handed to them as a federal government to use more widely? Because they, as I said earlier, they have had to focus on priorities such as, vaccination and looking after the healthcare system, and the use of the most precise testing procedure, which is the molecular test. Now, when you have significant prevalence of the virus in a particular environment, molecular tests, that's what you need to use, because you don't want to miss anyone. So molecular testing has been, until now, probably the most important type of testing that we could use, because to protect the health and safety in environments where there is a lot of COVID-19 incidents, that's what you absolutely want to focus on. But now we've been moving to a different level of community transmission for some time. Obviously, things are changing in some of the provinces right now. But with that, we are now, in most provinces and territories, better able and certainly better guided to use the rapid test in appropriate circumstances.
Okay. Mike to my left.
Laura Osmond, the Canadian Press. Thanks so much for taking our questions this morning. My question is about this testing and mandatory quarantine policy for incoming travelers. The government's social media posts have been saying you will have to quarantine, you will be tested at the airport, as if this policy is fully enforced. You're saying we're only about halfway to the capacity that we need to fully enforce that policy. It's creating a lot of confusion for people who are worried about consequences for not following the rules when they don't really know what the rules are before they get to the airport. So what certainty can you give to people? What is their experience going to be if they're traveling in the next few weeks?
Well, there is one certainty, which is that the Canadians should expect to be tested and quarantined when they enter Canada through an airport from a place other than the United States. And they should expect that because, as we said earlier, we've made, not only was that present before November 30th, now I spoke about the 3,000 daily tests that air travelers were being administered randomly, but we've moved from that relatively small base, 3,000, and we've added 6,000 more tests, and we need to add another 6,000. So 3 plus 6 plus 6, plus 6 already, and 6 coming, that's, I think, will tell Canadians that the likelihood of having to be tested and quarantined when they come back into Canada, that likelihood is increasing quickly. Now, what they should also do is always listen to the directives of border officers and PHAC officers when they enter their particular point of entry into Canada.
I also want to ask you about domestic measures. I know we're not speaking about the modeling yet, but we can imagine that the effect of Omicron on our domestic case count could be very dramatic. And so you've been speaking with your counterparts at the provinces. I'm wondering, when this becomes no longer an international issue, if the Omicron variant does take hold in Canada, as the modeling no doubt predicts it could, what kind of domestic policies are you looking at with your fellow ministers in the provinces to limit the spread here?
Until now, and Dr. Tam might step in if you want, if you allow that to happen. Until now, the public health measures that have been understood and applied for almost 20 months now remain exactly those that we need to follow with the new variants. Social distancing, personal protective equipment, washing hands, watching symptoms, being tested if we've been in contact with someone possibly infected or if we have symptoms. So those are the fundamental public health measures that I understand need to continue as long as the variant, the virus is with us. I might turn to Dr. Tam just to say whether Dr. Tam have said something that he would have said otherwise.
Yeah, we know the public health measures that do work, and they will work against any variant. But we will go into things in a little bit more detail later. Thank you.
Thank you very much. Now we're going to go to the phones. It'll be one question, one follow-up, and the shorter the questions and the shorter the answers, the more people we can get in, because Minister Duclos does have a plane to catch. We want to get as many people a chance to ask a question as possible. Operator?
Thank you, merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. The first question is from Erica Walsh from the Globe and Mail. Please go ahead.
Good morning, Minister. Thanks for taking our questions. I just wanted to follow up on just one data point. You said today that testing capacity has increased 50%. Earlier this week, you were saying 60%. So just to clarify, so it is now 50%? And to Louis Blouin's question, when are we actually going to be fully there? You're saying these are necessary steps. So when are we actually going to have that fully in place? Will we be able to have it fully in place?
Thank you. And yeah, I understand that these percentages can be confusing. The overall, there are two pieces. The one piece is air travel. The other piece is land travel. So if we add land and air travel together, all the tests at land and at airport, as we said earlier, we need to increase that total testing capacity by 60%. Now, if we focus only on air travel, we were at 11,000 on November 30th. We're now at 7,000, so it's an increase by about 50%. We need to go to 23,000. That's for just air travel test.
Marika, do you have a follow-up?
Yes, I do. Thank you. So going on to your comments about travel being risky and unstable, or that the situation abroad is both risky and unstable, is I think the terms that you used. Are you planning to change the advisory that is currently in place that Canadians who are fully vaccinated can travel? You seem to be strongly warning against travel, but the official advice appears unchanged. So can you just clarify which advice Canadians should be following? Is it safe if you are fully vaccinated to travel, or will the government be changing its formal advice?
The advice that we're using is a combination of the advice of public health officials within Canada and that the advice coming from international partners, including the advice that comes from informational flows that they transfer to us, so we understand better, obviously, the situation outside of Canada when we have great collaboration with our partner countries on what they see on the ground. So it's a combination of what experts here tell us and what we hear from others outside of Canada. So it's a combination of these two, and the resulting advice to Canadians therefore changes as the situation evolves. The main advice is to be extremely prudent when it comes to thinking about traveling outside of Canada. We're not currently advising Canadians not to travel. That could come, and if it does come, it will have to come through a combination of different input, as I said, in different sorts of advice. But what we see now, what we hear now from public health officials in Canada and from the international context, is that people need to be very aware that traveling outside of Canada, as I said, comes with risk and uncertainty, and things can change quite rapidly.
Next question, operator. And if I am serious about if people can ask questions quickly, then we will be able to get more people in, because unless the minister can stay later than I've been told, we've only got 5 minutes left.
Next question from Boris Proulx from Le Devoir. Minister, 6,000 tests missing. What is going on with that? Those missing 6,000 tests. There are travelers coming in without getting tested. Minister Duclos, two things are happening. First of all, there has been incomplete capacity until now, even though, as we've said over the past days, we have ramped it up significantly. Secondly, there is always prioritization of the allocation of these tests, whether it be at the land border or at airports. People arriving from abroad have been tested randomly, yes, but it has also been not random because we have paid attention to the risks that these people could be carrying the virus. Follow-up question, do you have an idea of the percentage of how many people have been carrying the virus out of the tests? Answer, I will leave that to the doctors because that information changes rapidly.
Boris, est-ce que c'est possible d'avoir le rapport de la deuxième partie de la conférence de presse?
Could we give you the rest of that answer in the second part of the press conference? Yes.
The next question is from Alex Balingal from the Toronto Star. Please go ahead.
Hi, thanks very much. I just want to clarify, Minister Duclos, you said that you expect the transmission of Omicron inside Canada will change, or the community transmission will change, if I heard correctly. Can you just clarify what you mean? Are you guys expecting that despite these border measures and the testing capacity and all the things you're doing to try and prevent more cases from entering Canada, that community transmission of this variant will increase?
Well, the answer is yes, community transmission it will increase, and and in fact, it's an important feature of the presentation you'll hear very soon from Dr. Tam and Dr. New.
So just quickly as a follow-up then, so what is driving that? If we're focusing on the border, what do we need to do to try and prevent that increase? Are we doing enough? Why are we expecting it to increase?
Our border measures are probably the most effective of all measures around the world. You know, we've we can always do better, but we've done extremely well compared to many other countries. And the reason is that we have multiple layers. The first layer is the pre-arrival test. Now, every traveler entering into Canada by land or by air needs to have a pre-arrival test. Now, the government has been criticized for that for some time. Now, we should not have a pre-arrival test, but that's an absolutely central feature of our border measures right now, and this was going to be maintained. The second layer is the arrival test. That has always been there, but we're in a partial randomized manner. And now what we're doing right now is to make it complete for an important portion of air traveling. Then we have quarantine obligations that we have had since the beginning of COVID-19, and these measures, not only have they been maintained in many contexts since the beginning of COVID-19, but they were absent in many other countries. And that's another reason for which we have been extremely good through limiting importations of the virus and now the variant compared to many other countries. This being said, as we mentioned earlier, these tests and these procedures are by definition imperfect. So although they delay very significantly the importation of the virus and the variant, they are not going to stop the variant and the virus from entering into Canada. And that's why community transmission, although quite limited now, is going to be a challenge when the variant becomes more prevalent. But on that, again, it will be useful to hear and to turn to Dr. Tam and Dr. New.
We have a couple of minutes left. Operator, next question.
La prochaine question de Annie Guillemette.
Next question from Annie Guillemette. Over to you. Thank you. Good day, Minister. A few times you mentioned travels. I'd like to hear you in French on your official recommendation. You told Louis Blouin that things are changing quickly. But where are we on the government's official recommendation? Answer. Well, what we're telling people is that in Canada, at this time, there is very little Omicron spread. But abroad, in many countries where people may be hoping to travel, the situation is changing very quickly, and risks are doubled. Number one, people may go abroad and find themselves in very difficult situations because measures in other countries can change very quickly. And we saw this happening over the past 20 months with COVID-19. The second risk is when people come back to Canada. They will face procedures at the border. These measures take time. There will be delays. They may need to quarantine for a certain number of days. It may be many days because we may need to be strict and severe in order to protect Canadians' health. So people must be aware of that double risk when they are abroad and when they come back to Canada, which again is a time when they may face delays because of procedures. Follow-up. So there is no recommendation not to travel currently. Second question, on the delivery of rapid tests, should we trust manufacturers and companies because provinces and territories, regarding provinces and territories' shipment dates? Answer. The situation is going very well. I spoke with Mr. Dubé in Quebec. The province of Quebec has requested the number of tests it needs, and those tests, 10 million to be exact, will be delivered in time for the holidays. Some will be sent to childcare services. Those come from the Government of Canada, and the Government of Quebec will use them, including in those childcare centers for young children and young families. And other tests will be delivered over the coming days in order to attain that requested number of 10,000 tests to be delivered to Quebec. And it is the same for other provinces and territories. Remember, those 35 million tests that we have promised to deliver is 5 times the tests that went unused. We are working very well together, and I congratulate all of my counterparts in the provinces and territories because over the past weeks we have done great work and have succeeded in significantly increasing the number of tests that will be available for families and people in Quebec and elsewhere. Thank you, Minister Duclos.
Has to bid adieu to us because he has his plane. So hold on, and we will be turning to Doctors Tam and New.
All right, we've been listening to the health minister there, and he's also along with a team of doctors who are providing us updates on the pandemic and the COVID-19 measures in place. The minister, of course, telling us this morning that the cases are rising across the country and they're ramping up testing at the airports.